This is a short presentation entitled Working with Children with Chronic Illness. Chronic illness is described as a human condition or disease that is persistent or otherwise long-lasting in its effects, or a disease that comes with time and may not have a cure. It can last anywhere from 3 months to a lifetime. Some common chronic illnesses include asthma, cancer, Crohn's disease, diabetes, epilepsy, heart disease, multiple sclerosis, mood disorders, etc. It is estimated that between 10 and 20 million children and adolescents in the United States have some form of chronic illness or disability. The impact of related issues on development and learning. Children with chronic health conditions deal with a large number of problems related to school performance, including reduced attention and concentration, poor motivation, resistance to school assignments, and absence issues. Problems for children with chronic health conditions are related to the requirements of treatment and the effects of the condition. Children may need to miss school for scheduled treatment or medical procedures, or they may be required to remain at home to reduce the risk of sickness. A chronic health condition and its treatment can sap children's energy at times, making it difficult for them to give their full attention in class and complete assignments. Pain and discomfort can make it hard for a child to endure a long day at school and complete homework in the evening. Emotional and social issues can also get in the way of school achievement. Feelings of sadness and worry may diminish the optimism and drive needed to do well in school. These children may worry about their health prospects, fear an upcoming treatment, or feel grief over the loss of physical activities. If the child doesn't have a supportive group of friends and teachers at school who are aware of the illness and accept the child for who or he or she is, feelings of being different can lead to problems with self-esteem and self-image. The negative feelings can hurt school performance. That's why the role of school social workers, teachers, and staff in working with this population is so important. If absences are required for treatment or recuperation, or to avoid contagious illness, a school social worker can advocate for that child, work with the parents and school to continue instruction through alternative means. This can be things such as online instruction or getting assignments that the child can do outside of school in order to prevent them from falling behind. If absences are required for treatment or recuperation or to avoid contagious illness, a school social worker can advocate for that child and work with the parents and school to continue instruction through alternative means. This can be things such as online instruction or simply getting assignments that the child can do outside of school in order to prevent them from falling behind. Sometimes medicine can be prescribed to that patient to address some emotional problems. A school social worker can do an assessment to determine if this may be an option. The school social worker can organize and be a part of regular meetings between the parents and the child's teachers as they collaborate and communicate regularly to address school performance problems, work with school administration on any special accommodations that may be needed, and the school social worker can be the conduit between the parents and teachers and sharing of information on the steps being taken in school, at home, and in the community to address any problems and also to track progress. The school social worker and teachers can take a multidisciplinary approach, incorporating medical, behavioral, and psychosocial behavioral support. Counseling is generally successful in helping children learn healthy ways to cope. School social workers can also establish criteria and educate staff regarding privacy issues related to the child's medical issues. School social workers can help advocate for IEPs or individual education programs, which are developed for each public school child who is eligible for special education. It allows teachers, parents, school administrations, related service personnel, and in some instances, the student themselves to work together to improve educational results for students with difficulties. Or they can advocate for a 504 plan, which provides basic accommodations in the classroom, such as greater access to the restroom, changes of clothes, and so forth. Parents should work closely with their child's school so that teachers and administration are aware of any special requirement the child needs. With school teachers and administration communicating and working together, any school related problems should be noticed and addressed quickly. While all issues that the child dealing with a chronic illness cannot be attributed to a medical issue, communication is vital, especially with the social work professional present. Continuity of care is important as the child may be able to navigate through school in the early years, but may experience issues later, especially in the teenage years. As the child advances, the school social worker, teacher, and administration can be integral in helping subsequent teachers, school social workers, and administration establish communication channels with the parent and provide additional support. Some additional helpful resources that can help when children with chronic illnesses are peer to peer programs, volunteer organizations that provide education, support, and advocacy to the children and families, and also the Center for Parent Information and Resources with a wealth of information about resources available to these parents.